do shoulder elevation, shoulder depression, shoulder abduction, shoulder adduction, shoulder circumduction, external rotation of the shoulders, internal rotation of the shoulders, shoulder flexion, shoulder extension, scapula retraction, scapula protraction. Elbow flexion, elbow extension, forearm supination, forearm pronation, wrist flexion, wrist extension. And spine movements, spinal flexion, spinal extension, lateral spinal flexion, spinal rotation, and finally the lower body, hip abduction, hip adduction, hip circumduction, external rotation of the hips, internal rotation of the hips, hip flexion, hip extension, anterior tilt of the pelvis, posterior tilt of the pelvis, knee flexion, knee extension, ankle dorsiflexion, and ankle plantar flexion, foot inversion, and foot everversion.